That's the relatively new one. Maternal childhood abuse can lead to autism to her offspring. Till now, we were thinking like that the prenatal condition of the mother may affect the offspring. In ADHD also, it is formulated like that. But the recent finding is that even a abuse in her childhood makes her predisposed to have an autistic offspring. There are several mechanisms that is attributed to that. You can read in PubMed Central with articles relating to that. But it's a new field, new thinking, new concept that the maintaining factors come from the childhood of mother itself. It can happen like that. And second is that we know about prenatal stress for the mother can have so many problems in offspring. But when? What type of stress? That is also little more explained nowadays in various journals. So that in autism, they say the maternal stress in mid-trimester, somewhere around 19 to 26 weeks, between 19 to 26 weeks, it's more important in autism and ADHD. Now, it is not said as autism, they say it's autism spectrum disorder. Now, we are not supposed to tell us simply autism. Okay. So, then what you have to look is the stress of the mother in between 19 and 26 weeks is important, and that is what we should look. So, okay, some think that autism is a behavior change. No, there are some structural changes that is found in brain, and especially the orbitofrontal cortex and amygdala. Amygdala is also very important area because it is related to fear, emotions, and all. And once the amygdala fails, you don't have fear, you don't have how the emotional responses are there, emotional flattening there may be there. So in autism also it happens like that. The next one we have to be very curious about is the use of mercury. See, autism was past related to MMR vaccine, and they said it was thiomersal there in that is that causing autism, but that has been disproved. But they have never said that mercury. They always still say that mercury can cause autism. So that is very important thing you have to think that mercury is still a cause for autism. Then there are viral infections, amygdala failure, leaky gut syndrome, vitamin D deficiencies. There are many theories for that. That neuronal migration theory is there, defect in calcium channels is there, mirror neuron theory is there. But I want to emphasize three major things. I want to introduce that three things. One is that maternal abuse in childhood.
Excuse me, sir. Sorry, sir.
Yeah.
Please start your video, sir.
Video.
Yeah.
Video.
Yes, sir.
Is it okay? Can you see me, ma'am?
Yes, sir. Yes, sir. Yes, sir.
Okay, sorry. So, let's stop that. The three major causes which I want to emphasize from all these causes is that one is that the maternal stress between 19 and 26 weeks. That's very important. Second, you have to find out the stress of the mother in her childhood also. Any physical, sexual, or emotional abuse in childhood also can be a cause for autistic offspring. And third is the effect of mercury. The other factors are there. So these three concepts that you have to be, keep in mind in managing a case. Let me see. So how it affecting our homeopathic case taking. So in every we are having a we are going to deal with a child 2 years, 3 years, or 5 years. We may not get many information from the child itself. We can only have an objective information from the child. The child may not be communicating with you. What you have is a history. Apart from the reactions, the sensitiveness, the cravings, you have a history. And what history of the child? You have to have a history not of the child, but also the mother during a pregnancy, but also the history of the mother preceding her pregnancy and her childhood also. That's the new thing that we have to do. Till now, I too wasn't aware of this fact, and I never took such a long history of the mother. But that too, maybe we should take into consideration. Second is that prenatal history. Should we look into the whole history? They say after 19th week, the glucocorticoid effects, the stress causing glucocorticoids will be affecting the neuronal system. Only after that, that will be happening. So, any occurrence of this for the mother between 19 and 24 weeks is what we have to look for. Economic problems, divorce problems, environmental issues, so many things you have to look. Even a thunderstorm or a corona scare, anything can be stress for a pregnant mother. But what all stress will take? There will be a lot of stress the mother woman will be going through. If only that stress is very striking, and after that, so many things have changed for her. That only we will be looking into. Not every stress we are going to take into account, but only that which after that, if you can have a before and after stress, something has changed. That will be looking into. Okay, this Sam. And Mercury, that's very important thing because see, we have. I mean, I never thought of Mercury in autism, but there are some other medicines were there. I didn't never thought. But see, we have the word erythrism in our medical. A lot of medicines having that, and actually it is erythrism mercurialis. That's a neurological disorder. It is characterized. It's a mad hat of disease that we all know, the tremor and everything. But irritability, low self-confidence, shyness, apathy, personality changes, memory loss, difficulty in social interaction, tremor, metallic taste. These all are symptoms of mercury poisoning. So if you have the repertory with you, you look up for the rubrics in mercury, you have extreme symptoms, anarchist, and people eating cow dung, mud, spitting in the floor on the mud and taking licking it up, all has mercury, goes to extreme levels. And see, I showed you the picture of mercury poisoning. If mercury can cause autistic symptoms, maybe it can cure also. And look at the poisoning symptoms. It's similar to autism. See, you are seeing a picture of autism in it, no? So, so that is the concept on that. And now we should see the core symptom. Okay, we should have a idea what is core symptom and comorbid symptom in autism. Then only we have to I can identify, make a totality on that. So first is that I explained earlier, a qualitative impairment in social interaction. Okay, it can be they are not able to understand your eye motions, look into eye, talk to you, do not know how to what social distance you have to keep. They don't know how to what is fear, the response of fear, how to fear, whom all to fear, whom all to make more love, affection. That is not there in autistic persons. So that makes socially socially a great problem for children to deal with the problems in society. Second is the stereotypical, ritualistic, repetitive, and restrictive patterns of interest, behavior, and activities. They'll be doing a certain things repeatedly and ritualistically. They'll be adding on blocks, playing with small things, repeatedly. They can view only a small portion of the thing. They can't see the big picture of a portion. So they are playing with a toy. They see only the wheel. They'll be looking at a fan. Regularly, it will be like that. Sorry. So these are very characteristics of autistic. The third is language problem. By the age of 2, they may not be speaking of appa or amma. Even language delay or communication, they are not able to give proper language development. So learning difficulties, learning problems will commonly associated with the autism. The other comorbid symptoms. comorbid, they may be, some persons may be hyperactive. That's not the core symptom of autism, but it's a comorbid symptom, hyperactivity. So many persons with autism do have hyperactivity, and lot of people will be having intellectual difficulty also. So you should understand that intellectual abnormality and learning disabilities are two different things. In learning disability, the person will be having normal intelligence but not able to do speak, write, or do mathematics. Subnormality is generally the weakness is there. So both can be there with autistic persons. Seizures are common. Then sensory hyper or hypo. Certain persons, children will be having high affinity to certain smell, certain touch. They may not be liking touch. That will be there. Then gut problems. So in the causes also, leaky gut syndrome was there. So many autistic persons will be having lot of digestive problems. In Ayurvedic concepts also, they say when you go for a autistic therapy, they first give vomiting and make the child have vomit and have diarrhea. Give medicines for that. They say we have to calm the Jadaragni. And I had an occasion to go to an Ayurvedic center, and she was explaining all these things were in it was mainly for autistic, and the gut problems was addressed first. And many people with autism in the initial phase they do have sleep problems as well. So these are comorbid symptoms. So what's important with homeopathy is that these are we can take as community for the main symptom. Okay. These can be associated with the main complaint in more or various severities. So the concept of autistic totality will be like that. One will be searching for a cause. After the homeopathic treatment will be finding for a acute cause, exciting cause in an acute case, and a maintaining cause in a chronic disease. So since this is a chronic disease, we'll be looking for a chronic cause. That is a maintaining cause. There are so many things. We said that a vexation, the mother can also be a maintaining cause. But actually, that concept of the mother cell vexation and in the totality is not typically correctly Hahnemannian, because in Hahnemannian concepts you only take the deviation state of mind of the state of health of the person only. You're not going to the mother. I really don't know how to match that, but since the scientific investigations are telling like that, we should also enlarge our scope to involve that rubric also into our totality. So the first is in autistic totality, we'll first see the post causal cause. One. Second, the core symptom. What all core symptoms are there? What all social behavior problems are there? Communication problems are there? What all activities are they doing regularly? So we can guess